This PowerPoint serves as an educational module for cricothyroid membrane identification utilizing the ultrasound. We are second-year nurse anesthesia students from Northern Kentucky University. We thank you in advance for your time and for participating in our DNP project. Please make sure to complete our pre-test before watching this educational video. Our objectives are to explain the significance of an anesthesia provider's ability to accurately identify and assess the airway, review basic airway anatomy, review the cricothyroidotomy procedure, explain proper patient positioning, probe positioning, and equipment for ultrasound identification, identify the cricothyroid membrane and basic airway sonoanatomy utilizing ultrasound, and increase provider knowledge and confidence level for identifying the cricothyroid membrane utilizing ultrasound. A study by Garrett et al. 2023 suggested success rates for cricothyroidotomies were as low as 34%. One common reason for unsuccessful attempts includes misidentification of the CTM. Throughout the literature, identifying the cricothyroid membrane through the ultrasound is a superior technique in comparison to palpation. So why is this an important skill to have as an anesthesia provider? In the analysis of closed claims from 2003 to 2012, respiratory events were the leading cause of adverse outcomes, representing 34% of the claims, specifically 84 out of 245. Out of those claims, 69% of them resulted in mortality or permanent morbidity. In the claims regarding difficulty airway management, cricothyrotomies were either not attempted or were attempted too late. This could be due to providers' inexperience or lack of training regarding cricothyrotomies. In a recent study, success rates for cricothyroidotomies were as low as 34%. One common reason for unsuccessful attempts includes misidentification of the cricothyroid membrane. Throughout the literature, identifying the cricothyroid membrane with the ultrasound is a superior technique in comparison to palpation. So in summary, it is crucial for CRNAs to be able to manage the airway in both routine cases and emergency situations, such as a can't ventilate, can't intubate scenarios. Proper training and education for CRNAs regarding cricothyrotomies could save a patient's life and prevent significant complications such as brain injury and cardiac arrest in emergency airway situations. Accurate identification of the cricothyroid membrane must be made in order to successfully perform a cricothyrotomy. The ability to accurately identify the cricothyroid membrane and successfully perform a cricothyrotomy can prevent adverse outcomes such as mortality and permanent brain damage, which can occur after 5 minutes of an unsecured airway. Here is a review of the upper airway anatomy showing important airway structures from an anterior view. It is helpful to review the basic anatomy before identifying structures using ultrasound. We will specifically be focusing on the thyroid cartilage, cricothyroid membrane, and cricoid cartilage for this skill. The assessment of the upper airway can be performed using 5 views: suprahyoid, thyrohyoid, thyroid, cricothyroid, and suprasternal. Training and understanding of applied airway sonoanatomy will enable providers to identify abnormal or difficult airway and perform procedures such as percutaneous cricothyroidotomy or tracheostomy, confirmation of endotracheal tube placement, and performance of regional blocks for airway management. Let's review the steps of the cricothyroidotomy procedure. First, you are going to prepare the equipment. You will attach a syringe half filled with saline to the insertion needle. Next, you are going to locate the cricothyroid membrane, which we will review how to identify in the upcoming slides. Next, you are going to cleanse the area. Next, you are going to stabilize the larynx with your non-dominant hand and grasp the sides of the thyroid cartilage using your thumb and middle finger to steady the larynx. You should maintain this hold throughout the procedure until the airway catheter is securely in place. Next, you will insert the needle and puncture the cricothyroid membrane. Angle the needle approximately 45 degrees downward toward the feet. As you advance, apply gentle back pressure on the syringe plunger. Next, a tactile pop may be felt as the needle enters the trachea. Confirmation is achieved when air is aspirated into the syringe, visible as bubbles in the saline. Once air is observed, cease advancing the needle. Lastly, you will carefully remove the syringe from the needle. If a catheter is present over the needle, ensure it remains in place for subsequent steps. Okay, now let's talk about identifying the cricothyroid membrane with the ultrasound. You will want to use a high-frequency linear probe. The probe can be positioned sagittal, which is seen on the left image, or transverse, which is on the right image. The transverse method is the preferred method because it has been proven to obtain a view of the cricothyroid membrane easily and is usually quicker to obtain as well. The patient can be positioned supine, sitting, or semi-recumbent. Since the transverse probe view is the preferred method, we will be focusing on that. A common method used to obtain an image of the cricothyroid membrane is the thyroid airline cricoid airline, also known as the TACA method. So you are going to start cephalad and slide caudal. There are 4 steps that we will be reviewing over the next few slides. 1. First, the prominent triangular V-shaped thyroid cartilage is visualized, as you can see in the top right picture. 2. Moving caudally, you will see the hyperechoic bright white line, and that is the cricothyroid membrane. For the 3rd step, you are going to slide more caudal, and the hypoechoic lateral edges of the cricoid cartilage will appear to converge anterior to the cricothyroid membrane, as seen in the top right image. For the final step, you will scan back cranially, and the cricothyroid membrane can then be identified again as the hyperechoic bright white line as seen in the bottom right image. We are now going to briefly touch on the sagittal view. You will begin caudally and working your way cephalad. You will identify the tracheal rings first. It resembles a string of pearls, as you can see by the red arrows on the photo. You will then slide the transducer cephalad until you see cricoid cartilage, which is the largest and most cranial pearl, as noted by the orange circle on the image. The thyroid cartilage is located above it, and the cricothyroid membrane is positioned between the two. The cricothyroid membrane will appear as a bright white line in between the cricoid cartilage and thyroid cartilage. Here is just another picture of the transverse view of the cricoid cartilage, with a high-frequency linear transducer over the cricoid cartilage. The arch-shaped cricoid cartilage is marked with stars. The arrow is pointing to the cricothyroid membrane. The top image is the transverse probe placement. The solid arrow is pointing to the cricothyroid membrane. The bottom image is the sagittal probe placement. Let's start caudal and make our way more cephalad. The star is the cricoid cartilage. The dashed arrow is the CTM, and the solid arrow is the thyroid cartilage. Here are our references. Please make sure to complete the post-test and to attend our hands-on training day if you can. Thank you for your time.